Dr. Tom Frieden served as a director of the Centers for Disease Control and Prevention under the Obama administration. He's now president and CEO of Resolve to Save Lives, a global health initiative. Dr. Frieden, good morning. It's good to see you. Boy, you look at those images in Kathy's piece and it takes you right back to March and April and what was happening in New York City and other places now happening across the country. We can't say you didn't warn us. You and others said we're going to go through some phases here and this is likely to come back in fall and winter. So where are we right now in your assessment?
Well, first off, we're seeing more cases in more places than ever. If you look at a single number, hospitalizations, they're at the highest number ever, more than 60,000 Americans in hospitals today. That number will increase within the next month to over 100,000. So stressed as hospitals are today, they'll continue to be stressed. And tragically, deaths are continuing to increase, and we'll hit, by the end of the year, 2,000 deaths a year. By the time President-elect Biden is inaugurated, more than 300,000 people will have died, reported to have died from COVID. Even more will have actually died from it. But there's really a lot that all of us can do to turn this around. It's not inevitable. It's not just the government. All of us have a role to play. Wearing masks, which most people are doing, watching our distance, washing our hands, and avoiding crowded indoor spaces. And unfortunately, that means changing our Thanksgiving plans, because traveling from one place to another, meeting inside with lots of families for a long time without masks, that's a formula for a massive explosion. Unless we change our Thanksgiving plans, we're going to have a very unmerry Christmas, I'm afraid.
It's an important message. I think a lot of people are coming to terms with the fact that this is just going to have to be a very different Thanksgiving and holiday season. So you mentioned inauguration. We're still more than 2 months away from the Biden administration taking over. What kind of coordination in a conventional transition would we be seeing and should we be seeing right now between the Trump administration in this case and Biden's transition team?
In this country, we only have one government at a time, and the current administration needs to step up in terms of responding to the crisis that we have with coronavirus. At the same time, a transition is like a relay race. You're passing the baton, and that has to be done smoothly, because any stumble is going to, in this case, cost lives. That means ramping up our response and getting ready for a vaccination campaign that will be extraordinarily complex. Both of those things need to happen, because the vaccine is not going to magically make the pandemic go away, and it's not going to come as soon as we would like, though it's very fast. We still don't know how the vaccine is going to work. We still don't know which groups it will work for and whether it will be safe. But it's very encouraging to see a 90% protection rate from the Pfizer product, and other products will be coming out in the near future with their data. So this is a crucial time to have close coordination so that baton can be passed smoothly. And in the case of coronavirus response, we can reduce current cases, prepare for a vaccination campaign that's going to be extraordinarily important and complex, and continue to improve our work, being careful about what and when we close things. This is not about lockdown. We'd like to keep schools open. We'd like to keep retail open if at all possible. We'd like to keep the economy moving. At the same time, we don't spread the infections. And that means the government, communities, families, and individuals all doing our part to fight together, because there's only one enemy here, and it's a virus, the coronavirus. And the more we're unified, the more we can stop it.
And as you say, time is of the essence. Dr. Tom Frieden, former head of the CDC, thank you very much.